everyone. Good morning. Let's register our presence. Let me know where you are chatting from. Let me know where you are connecting from. Okay, I can see Omotunde Oluwafemi James, Moritala Faridat from Oyo State. Okay, Victory from Oyo State. Do we have only Oyo State DLCs in the house this morning? Okay, we have Yakubu now. Good morning. You are welcome. You are welcome. You are welcome to the National CDS Day today. Precious Ayomikbosi, I can see you. Tanimola Ayomide, I can see you. Okay, let's start. A warm welcome to each and every one of us. Okay, I can see our DLCs from Kebi, Bini Kebi. You are welcome, everyone. Okay, I can see Lagos State. You are most welcome. You're welcome to the September National CDS meeting this morning. And this month's theme is something I'm very sure we've been anticipating this time. Yes, digital health literacy and telemedicine. Thank you, DLCs from Abuja. Thank you, DLCs from Ebonyi State. Thank you, DLCs from Lagos State. Wow, this is amazing. This is amazing. Let's join. Okay, Ibadan Southwest. You are most welcome. You are most welcome. You are most welcome. All right. In an era where technology is revolutionizing every aspect of our lives, digital literacy equips our citizens as regards their health. And this morning, we are excited to have one of our well-renowned medical doctor who also specializes in telemedicine in our midst this morning. So a quick one, I'm going to read out his bio while he joins us and take us through what we have for this morning. Okay. Dr. Unkwe Obina is a visionary medical doctor and entrepreneur. Holding an MBA, Dr. Obina founded the Prevention is Cheaper Than Cure Medical Foundation, an NGO dedicated to transformative healthcare initiatives. He's currently working at Said Hospital in Abuja. His passions include combating infectious diseases, advancing telemedicine, and promoting digital health literacy. Dr. Obina is deeply committed to expanding healthcare access for marginalized communities and is currently working on a research aimed at eradicating hypertension. Before I bring him on board, let's have the national anthem. All right, please let's take the national anthem. Let's be upstanding as we take the national anthem, please. Thank you so much, everyone. Thank you so much. So, a quick one before we start this session and before I bring up our speaker, I want to I want to prepare our minds. What do we what can we say telemedicine is? I'm right in the chat section, in the comment section. What can we say telemedicine is? Oyo State DLCs, Lagos State DLCs. What can we say telemedicine is? FCT, Ebonyi, Anambra. When you hear telemedicine, what does that mean? I think the name is so straightforward. It's something we can easily grab. What's telemedicine? Okay, telemedicine is the remote diagnosis and treatment of patients by the means of telecommunications technology, more like telehealth, right? Telemed. Okay, thank you, Udo. Am I right? Okay. God's will. Telemedicine is getting medical consultation over the internet or remotely. Damilola Ogundipe said, using electronic health and communication technologies by means of telecommunication. Iceberg digital medical consultation. Okay. I think we are all ready. We are prepared for medicine is the information and communication technologies. Okay, okay. This is amazing. This is amazing. This is amazing. All right. Right about time, I'll be bringing up stage our amiable speaker, Dr. Obina, to take us through what digital health literacy and telemedicine is. Please, let's get ready. Let's get prepared with our questions and answers because it's going to be an interactive session. Because basically, most of us, anytime we have headache or stomach pain, okay, give me the home remedy and the likes. So let's prepare our questions for our speaker. You are most welcome, Dr. Obina. Good morning, sir.
Hello, good morning. I can't see myself, so I don't know what that others are saying.
I can't see you either.
So
I guess it's the network.
imagine this thing happening and where there is consultation in telemedicine. I wonder. So I think this is one of the barrier. Uh, it's minor things where there is error, there is glitches, especially in a country where the internet services is either expensive for the low income earners or the person is not having any knowledge on how to use digital gadgets. So please, I don't know if I can continue with or without my face because of time, because I'm time bound. Okay. So I have seen most of their write-up, their definition,
Okay,
two things
we
are
can continue.
important. I think I can continue whenever my face comes. Oh, we move. Can I go on? No, no, it's not there. So or you can add a picture to it. I think we did a test run and it worked earlier. I think a picture will be enough so that we can continue.
Okay, well, while we wait for our speaker this morning, I could still get some definitions of what telemedicine is from our DLCs. Okay. Albert said telemedicine is the transfer of medical information by means of telecommunication technologies for the purpose of consulting or for remote medical procedures or examinations. Wow. Okay. Telemedicine is also known as telehealth, uses technology to provide medical care remotely. Thank you so much, Penina Daniel. Oh, wow. It's going to be an interesting session this morning. Telemedicine is all about using computer technology in medical perspective. Abubakar did not come here to play, giving us back to back. Okay. The use of communication technologies to provide healthcare services and information. This is said by Gideon. Gideon, which state are you representing? Gideon. Is it there? Okay, telemedicine is taking medical care beyond the physical and making it available just over platforms and electronic means. Elizabeth Precious Adeyi. Wow, Precious is not here to play. Telemedicine is a way for healthcare providers to provide clinical services remotely through videos and phone calls. Wow, really? So we can use phone calls too for telemedicine. Ah, God I beg you. I think I'm even having, what's it called? I'm trying to get this thing. Hope telemedicine is not like how do I call it now? Hope is not like self prescription, or do medical doctors also use telemedicine? Hope is not something against the medical word or the medical procedures, because I can't imagine getting my treatment through phone calls. Like, okay, do this, do that. Who's going to provide me the necessary um, drugs and all? Or we can actually prescribe drugs, prescribe injections via phone calls. Wow, Jesus in mind. Hey, telemedicine is the delivery of healthcare services remotely through digital communication technologies such as a video conferencing, phone calls, and messaging. Hey, okay. Today go long, sha. No wahala. Dr. Obina should better be ready to answer these questions. I'm making you laugh. No vex, oh. No vex. NTBD. No vex, no vex. This one that I can get my what do we call it sef? My treatment via video conferencing. So you mean I can actually get healed if I'm strong through video conferencing? Is it Zoom we are using or Google Meet? All right, Mr. Mr. Obina is here to answer us. You are welcome back, sir.
Thank you. Am I live now? I don't know if I'm
Yes, you
live.
are live. Yes, you are live.
Okay, good morning, everyone. Thank you so much for the opportunity to once again be with my CDS. I'm always a CDS member of Digital on Borders, which I think they have changed the name now. We know all the mission, the vision of Mind the Gap, and what we are doing now as digital champions. Without your work, without what you're doing, any form of literacy in digital era will be like doing nothing, because the success of whatever thing we are doing, whether it's digital in economics, digital in health, or telemedicine, it can never be successful without the kind of work you guys are doing. I believe you guys are doing a wonderful work, and God bless you all. So, coming to what we are discussing today, most of us here are digitally literate, but the problem is those that are there, the information we are going to pass to them. Because if those people are not digitally literate, aware, or muzzled up to be aware of how to be literate in digital realm, the whole thing we are doing is a waste. Okay, so imagine that you can access healthcare services, you can access your management, your clinic visit just by sitting in your house. Imagine the possibility, which is not even a possibility because it has already happened, where you are admitted in Nigeria and somebody in China is able to do surgery on you through a robot. This is has happened, and it's not like something we are dreaming, it's something that is in existence. All right. So any means or use of digital equipment to provide healthcare services where two parties are involved at a distance is telemedicine. That's the definition. So that's why it always have three modalities. It has It has now it is four. But before you talk about the modality, you have to know that in telemedicine, the factor is six. That will be the where the thing is the originator, the place where the provider is, and also the modality. These three things have to be in place for telemedicine to be effective. All right. Now, we have like I said, we have the originating site, the distance site, and the modality. Those are the key things for a telemedicine to work. The originating site is where the patient is, where the person collecting this service is the originating site. All right. Then we have the distance site, which is where the healthcare provider is. Then the modality, which is where I'm going to, because of time, take more of my time, because this modality is very important. Before the COVID or pre-COVID, we mostly have three modalities of telemedicine. All right. But then after then, the fourth one become the M. That's use of mobile medicine as a form of telemedicine. Okay. So with these modalities, first is the one of live video. Live video, when you talk about telemedicine, this is what comes to everybody's mind, and that's what most people are commenting there, where you have direct consultation to your physician or to whoever that is going to be in charge of your health, right? That's the first modality, live video, live consultation, which is one of the most popular. But we also have another second modality, which is also old, known as the store and forward. Nowadays, the people that usually use store and forward are the radiologists, people that deal with images, right? But us as a norm, we normally do it with our doctors, that our friends or your consultant or the person you are consulting, whereby you might have a rash or you might have an ailment, you can snap it and send to your doctor. So the difference is this: in the video chatting, the first modality, it's always in real time. Even the teaching I'm doing now is a form of telemedicine, because it's a part of education. Okay, so when we talk about live video, it's always in real time. This is one of the modalities, and you and the person is expressing ideas. You tell the doctor your stories. Definitely, there are limitations which will come, but at least you can access it through your home. Now, the second modality I was saying is the one that you store and forward, right? Maybe you have a rash on your skin, you can snap it and send to the doctor. The doctor look at it and be able to prescribe some few medications for you. But like I say, the people that use it now, or most time, is the radiologists. And thank God for the integration of AI in healthcare. Most of the radiologists, when you do some image, you can now forward it to different consultants all over the world. They can be able to make input on their own time. So most of the time, the store and forward is not in real time, because it's not something that needs to be tackled immediately or stuff. So what we do is you send it, they look at it, then they report the image result, right? Now, the third most important one is the monitoring, the remote patient monitoring, all right? In the remote patient monitoring, there are different aspects, but most people that use it, there are people that that have pace or pacesetters or some equipment inserted in their bodies to make sure that the functions of their body are regulated, so that when there is issue, it can alert whoever that is managing the patient, right? Now, there are also innovations nowadays where some BP machine, some sugar machine, when it's checked, it directly reflects on the system, so that the healthcare provider can also make input. So the person monitors you from far. And also, it can be also used in intensive care of a patient, where the screen is always placed on the person and the doctor or the physician monitoring the person is monitoring. So this one can be both real time and not real time. Like I say, there are three major modalities in telemedicine. All right. The important one is one, first, like as I mentioned, is the live chat. The form, the one I'm doing now, giving health education, the one that you have consultation with your physician, right? Now, where does digital literacy come in? Because telemedicine is like a first ton of digital health, right? For you to have digital health literacy, you must be a digital literate. And for us to have digital literate, that's where we have to mind the gap. That's where the function of the because the people my audience are the digital champions. So that's where you come in to battle the digital divide. Because without this, you battling the digital divide, anything we are trying to achieve in a world of telemedicine will be futile. It will not be successful, right? Now, what encompasses the major thing a patient should know? The major thing a patient should know, you should know how to go through the internet and get basic information. You should be able to know how to read a prescription. You should be able to know how to follow up with your prescriptions. You should be able to understand that this product is expired or is not expired because the person giving you care from far might not be there. So there are things that you should know. And when you are digitally literate, there are a lot of things and advantages you have for being digital literate, right? It will shorten your visit to doctors. It will shorten your emergency visit because if you have your vitals that are being checked and transmitted electronically to your physician, whenever that is the thing is going up or is getting abnormal, it will alert and you have prompt care from the physician. So for our digital champions, what you are doing is great job because the amount of people that you are going to indulge or onboard into digital space to train and learn things about digital are the ones that are going to benefit from this digital health. All right. So even the modalities I'm saying, how can, like I said about digital divide, we have the elderly, people in rural areas, people that are not even educated at a point of knowing how to operate system, right? Which is where you guys comes in. All right. So before I continue, right, I would like people to write down at least. Let's give 1 minute to write down. What do you think are the digital divide? What are the barriers that are making us not to have an effective digital health literacy? Let me see what you guys think about the barriers that make us not to have a successful digital health literacy, especially in Nigeria. Not everyone has access to smartphone. Okay, poor internet, finance, okay, regulatory barriers, lack of accessibility, okay, lack of internet calling. Not everyone has access to good internet. One of the barriers is lack of awareness about telemedicine. The word mind is also synonymous with awareness. So that's where we come in to make sure people are aware of telemedicine. Lack of access to digital device like laptops, lack of epileptic power supply, lack of technical know-how. Not everyone can use a phone. Trust issue, ambiguity of medical terms, even when there's access to smartphone and internet, equity and disparity, poor network in rural areas, and also lack of poverty network issue. All right, I think ambiguity of medical terms, even when the access is to smartphones and internet. All right, you people have answered very well. As you can see, there are a lot of barriers for us not getting into digital health. When the Minister of Health entered office, one of the things he wants to do was e-medical, right? But we cannot succeed anything in the online, in the world of digital, without people being aware of how digitization works, how being a literate in the digital world works, right? And like I said, most of my focus is in these modalities, right? I have not mentioned the fourth one, which I say is the mobile. Now, the number one barrier for anything, even in the healthcare sector, is poverty. All right. Some people might even have trained how to use the phone, how to do this, but if you don't have the phone, if you can't afford the training or the things needed, you cannot go anywhere with it. All right. Number two is, like I say, our called internet service. All right. So just like most time you'll be having a meeting before you know it, there is glitches. You cannot have such when you are trying to do a surgical operation from another country, operating a patient in Nigeria, then the internet one goes off or NEPA goes off. So imagine what could happen to the patient in the surgical room. All right. So all you guys have said are all legit. They are all the major barriers we have. So, how do we think? I think my second question is, how do we think we can improve the digital health literacy in the general public? Because this is our major work as Mind the Gap. Because I'm not talking just to the population of Nigeria, I'm talking to our digital champions, right? From these three modalities, that's live video chatting, storage and forwarding, which most of you do with your doctor friends, right? To tell you, snap what is wrong with you, to tell you what to do, right? And then the one of monitoring a person from afar. So these three modalities, how do we think that we can be able to teach the people that are not digital literates to know about this? How can we educate, inform, motivate, and empower individuals? So I need your ideas because we are the ones on the field, right? How do we think we can be able to motivate these people to be able to be digitally literate? Now, what is my aim? What do I want them to know about digital literacy? One, I want them to be able to read a prescription bottle because they are far from the doctor giving them. Two, I want them to follow the physician written instructions, how to have access or to navigate insurance information, how to make appointments with the doctors, because making appointments, even for us that are youth, you have to know whether you need a primary care provider or advanced care provider based on the kind of symptoms you feel, the kind of things you want to complain. There is a way your symptoms will be. Who you need might be a primary care provider. That's who you have to connect in the digital space. That's the way you will be. The who you need is somebody with an advanced healthcare provider, right? And when you talk about primary care provider, you have to know the specialty, whether you need a pediatrician, a doctor for doctor, a family physician, or the internal medicine physician, right? So you have to know which one you do actually need. So you knowing all this, you can get it in a sphere of the digital space. Now, there is a little, though AI have tried to interface for the doctors and the populace. However, we know that most of the times the information there might not be 100% accurate. Just like you try to learn how to drive a car by watching YouTube without actually driving it. There's always a difference between AI and a physical doctor. I know I'm speaking so fast. So let's move on. So we have been able to identify the barriers. I come back to my questions. How do we intend to go out there and teach people on health literacy, on digital health literacy? I think we have 1 minute for that. How do we intend to go out there? What modalities are we going to use? to make sure people are able to imbibe in health digital literacy. Creating awareness via community sensitization, workshop and digital literacy, creating awareness in various, securing sponsorship to distribute reliable gadgets to participants. Most people that participate in some events lack the gadgets to practice. Okay. Health literacy, this is really a good one. Bring the information close to them in the environment by effective sensitization through collaboration with the available medical facility around one. Okay, and I think it's also to train and retrain the healthcare professionals on how to be digital health literate. Because first you have to train the trainers, which we are doing to you guys, but not all of you are into the health field. So, like, I have not used this platform before, but when I was sent the link, I was able to navigate through it because why? I'm digitally literate. I'm part of digital onboarders. So there's somebody that even if you're a doctor in any field of work, you can also lack some basic knowledge in digital world. So the thing is, I think the first step will also to create awareness and fill in the gap where we have to teach also the healthcare practitioners, right? That's why even as we are onboarding, as we are trying to make people to be aware of the digital world, we can also go to hospitals to retrain the nurses, the doctors on how also to use this because regardless of the information they know, they didn't study digital literacy course. All right. So, and I also agree with somebody that said partnership with respected doctors can also strengthen people's trust. Another thing that can strengthen people's trust is also to create a body or a sub-body to the council that regulate the medical council and the data council so that there can be people that will license the doctors or to rigorously examine the doctors that are going to be doing the online interface with the patient so that the patient will know how to be able to manage the patient. Cost of setting up, okay, we can also use the multiplication system just like digital if they're training people and empowering them to train others. Okay. All of you are wonderful. You even know the topic more than me. All right. Like I said, one way or the other, with the modalities I've mentioned, we have somehow used this digital health literacy without even knowing, right? Yeah. Digital health literacy is broad, like I said, it is a topic that can even take months to dissect. But however, we need to do more on making people to be digitally literate for digital health literacy to be able to thrive in our country, Nigeria. So I think before I start taking your question, I think I'm the one asking things. So let's I'd like to read out. I want you guys to write the benefits of telemedicine. What do you guys think are the benefits of telemedicine? So I think after that, I'll open the floor for your questions so that I can be able to address some, then we'll call it a day. So please, let's see, what do you think are the benefits of telemedicine and also the benefit or the disadvantages of telemedicine? We have like 1 minute for it. Accessibility. So what are the benefits? What are the disadvantages of it? It saves life like first aid. Benefit is sound health, easy consultation path. Convenience, it saves time and costs better access to healthcare continuity. It takes treatment to those who can't make it to the hospital, saves time and resources. Okay. It takes to those who can't make it to the hospital. Good. So, I have it helps to get medical treatment faster. All you have said are all valid, all right. But like I say, the idea of the digital literacy, because you cannot be able to benefit from this telemedicine or consultation of a live chat with your doctor if you can't be able to follow up your physician's instructions on what to do. If you are not able to read that a bottle, a drug container is expired or not expired, if you are not able to administer the medication, if you are not able to understand consent, all right, or when to ask the right questions to your doctor for effective communication. So I think it's almost the time. You can use this opportunity to ask your questions so that I can address some of them. We'll call it a day. So I'll be watching your questions. I'll be addressing them while we look at the future of telemedicine, right? So the future, there will be integration of artificial intelligence and machine learning. The role of telemedicine in public health and global health initiatives will, I think all this future is already here, right? Increased use of wearable device for remote monitoring. Most of the future they are talking about are already here, right? Mostly in the monitoring of the patient, mostly the monitoring of patient from from hospital to home. Most people I know now are on gadget and are monitoring from distance. Even some of them are monitoring from different countries. Okay, so please use this opportunity to ask any question you want on today's topic so that we can call it a day. So we want to do physical examination. Doctors cannot perform hands-on assessment. My question is, what specific problem are we trying to solve with this telemedicine platform? Okay, my question is, what specific problem in healthcare are we trying to solve with this telemedicine platform? I don't think there is a question of specific. What is going to stop is multi, right? Let me give you example. For instance, what their recommendation is 1 to 400 to 600 patients. But a typical Nigerian doctors, we average of 20,000 doctors in the whole of Nigeria with a population of above 200 millions, right? Now, it means that a doctor sees average doctors to patient coefficient is 1 to 10,000 compared to 1 to 400 to 600 as recommended by World Health Organization. So you're asking, what can this do? It can reduce the work burden of the healthcare system. For instance, some people are trying to find a way to inculcate the other practitioners all over the world, especially Nigerian medical doctors, right? Where they can be able to even run some kind of clinics for the people in Nigeria. So imagine where those doctors that are outside the country that are above 100,000 in different parts of the world are able to have time to give us a virtual clinic setting where you can be able to talk to a doctor at any convenient time. So it makes it easier access to reach out to your doctor, right? And reduces the cost of hospital admission or the hospital strikes and stuff. How fast can this telemedicine be observed or implemented? You cannot be able to measure the speed when you're talking about Nigeria as a country, right? The speed depends on us, the digital champions, because it's the people that are using what is the other use of telemedicine aspect that require physical attention. What is the other use of telemedicine aspect that require physical attention, like surgery? You can use it for the initial consultation because even for the surgery to happen, there is always a consultation prior to the surgery. And when you're able to do the one I call storage and forwarding, where you can send your result to your doctor or that is far away before the person flying to do the surgery, there can be use of telemedicine in that aspect before the surgery. But like I told you before, that they are trying to do an institution whereby even a surgeon that is outside Nigeria can be able to operate with robots to a patient that is in Nigeria. So that's also a form of telemedicine. What is other use of telemedicine as physical activity? What is the other use of? Is telemedicine a career path on its own, or there are areas of specialization in telemedicine? For now, there have never been a specialty called telemedicine, right? Because the word tele means far, distant. Whereas medicine means, which is medicere, means to heal. It means far healing. What is trying to say that every aspect of medicine, that's specialty, supposed to imbibe in telemedicine. So it's not like there are going to be a special people that, oh, they have studied telemedicine. So telemedicine is a form of medicine itself, where every consultant, every specialty should use. How does it intend to thrive in rural areas that have no access to digital service nor internet? All right, that's where the fourth one comes in, the mobile form of digital health. All right. The people in the rural areas, most of them might have their mobile telephone, their Nokia Touch, which, if we remember when we started this our new digital literacy program, we are trying to say that even when this patient have, they can be prompted, a message can be sent to them through their small touch, because more than 90% of Nigerians uses phone. It might not be Android, it might not be phone that can connect to internet, but they have SIM card. So there is a way, in as though there might be limitations, but at least prompt message, prompt guidance or where to go or where to access care can also help in such a situation. Digital device or internet. Like I think it's still in Tonga Joy. How does it intend to thrive in rural areas that have no access? What is the financial implication of telemedicine? Economically, at the beginning of any investment, if I'm talking I will talk from a point of Nigeria and from point of individual. For Nigeria to start telemedicine, initially it will cost a lot of money. We have to upgrade our internet services. We have to make sure that insurance policy works or people are registered to NHIS, right? That's the first step. Then at long run, we find that this can even boost the GDP and economic growth of Nigeria, because much people will be involved in both in the management of these patients, right? Which will also get more money for the country. But for the individual, it gives you quick access to any healthcare provider, both inbound and outbound, both foreigners, that people that are staying in Nigeria and people that are not. What group of patients should we prioritize? Everybody is a priority, but most likely, you see, for example, it depends on the modality, right? You see the elderly ones that requires constant monitoring. We should work hard to get those things that checks vitals and automate them into the healthcare system. That's electronic health record, right? Those ones that cannot easily access healthcare, those ones that are in the rural areas, should be our priority, right? And how can we do this? Somebody said about partnering with some big organization and stuff. We can be doing outreaches, We can also be distributing gadgets in some developed country. What they do, they can give you the Android phone for free, whereas you recharge. The more you recharge, that's why we call locked phone. They will use that particular subscribers, and they'll be using it to be accessing health information. So that can be partnering with some internet and network providers where they can be able to distribute phones that are locked with their SIM card. At long run, they'll still benefit from it. So what are the security risks that are involved, such as malware, hack, or data security? There is nowhere that we will not have disadvantage. The security malware, if it's a national program, there will always be people that are going to work against this malware and antivirus. Most times, yes, it's possible because while I was in med school, the whole country was hacked. The whole place went like blank. Because they are trying to access the information of a whole country. So as far as something is online or in digital space, there is always an opportunity for it to have malware issues or even be hacked. But in any aspect of medicine, what we always our principle is, if the drug we are giving, the therapeutic or the advantage is more than the harm it will give, you give the medication, because there is no way, whether you're doing telemedicine or not. I believe, based on the thing most of us have typed here by the benefit, I believe the benefits outweighs the risk. How can healthcare providers assess and also address gap in digital health literacy divide for telemedicine access in low-income societies? Now, I think people that are into information technology should liaise with the people in the healthcare, because there is a gap when you are only aware of digital space, you are not aware of health. But when they work together, right, I think this divide can be amended. This gap can be amended. So we'll start by, first of all, informing the public, educating the public, creating awareness on digital health literacy. Because what people are not aware of, they cannot try to learn or understand or to implement, right? The important thing about telemedicine is not just about understanding or knowing. The key thing is about implementing what you have learned, right? So for this to address this gap, both people in information technology, both people in the digital world that have more experience in digital world, have to come together with people that are in healthcare sector. All right, so for the remaining question, I think we can send to Mind the Gap X comment that format Twitter, and you will answer there. Please, thanks for your audience. Catch you some other time. Bye.
Thank you so much, Dr. Obina. Thank you so, so much. So before I proceed, please let's take our attendance. The link is on the group, is in the comment section. So please let's take our attendance. Well, so far I've been checking through the comments, each and every DLC's comments, and honestly, I can sense sympathy for those in the rural areas. And this is a proof that DLCs has been going to the field to work, and we've been working diligently. Honestly, let's celebrate ourselves. Let's celebrate ourselves, because these questions are intriguing questions. They are questions that, oh my god, Okay, so let's ask our. I believe most of our questions has been answered. So I want us to drop our key nuggets, the things we've the things we've learned today, the things we are looking forward to implementing in our various DLCs, please. Okay, I believe our people are still trying to get their names registered on the in the attendance list. Okay, let's check through the link pinned on the chat on the comment section, please. Let's work with the link pinned on the comment section. So personally for me, I was jotting. I had a lot of things to say, a lot of things I picked, a lot of things I feel we should add to our projects. Yes, our projects in our various CDS group. And one of the benefits of telemedicine that I picked is the fact that it reduces risk of infection. The second thing is it improved patient outcome and chronic disease management. The third thing is it's better support for mental health. So no one is going to like have to be running helter skelter whereby everyone will know whatsoever the person is passing through. Another thing is promotion of preventive care and education. While lastly, yes, promotion of preventive care and education. Please, is Dr. Obima still around? Because I have a question for him. And the question is that, and the question is that telemedicine, is it like a full replacement for in-person um, examinations? Or we are working towards it?
Um, Medical examination, or even what you call physical examination, has three aspects: the inspection, the palpation, the percussion, right, and the auscultation, right. So the only one you can be able to assess through telemedicine might be just the inspection, like looking at the person's face, right? Every other thing you can get through questioning. Telemedicine cannot exchange physical aspect of medicine. However, telemedicine can enhance the the scope of medicine outreach to the patient and minimize workload and improve efficiency and time lag between patient doctor interactions, right? So telemedicine is an addiction for improvement of healthcare, but it's not a substitute for physical. Even the doctor, no matter where you are, no matter the rural area, there is always an access to a healthcare facility. So why the person assess you? Because even in medicine, there's what we call clinical diagnosis, a diagnosis that you make just by doing some basic questioning and basic examination, right? For instance, there is the third part, which I said, storage and forwarding, where somebody might have skin infection and snap it. Me looking at the rashes, knowing the type, I can make a diagnosis from it, even without doing any other further investigation. So some diagnosis can be made just by inspection, just by looking at it, right? You can have idea of what it is. Then in a situation whereby it requires a physical touch, you can guide the person to visit the nearby hospital for proper evaluation. But if it's something that you can handle immediately, at least you can give the person one or two advice or one or two medication to calm down the situation before they're able to access a healthcare provider. So telemedicine in summary is an addition for effectiveness of practice of medicine. It's not a substitute. Thank you.
All right. Thank you so much, sir, for clarifying this so that our people will not think the only way we can get our prescriptions, and the easiest way to get healed is through making a phone call or a video call with our physician. So, so far, I want to ask, what's the percentage uh, of people or of physician practicing telemedicine? Like, what's the average, like the percentage, so that we can know how serious this telemedicine needs to be adopted.
No, no,
And
we don't have any empirical or research data in Nigeria for people practicing telemedicine, right? But I know that indirectly more than 20-30% based on personal experience are into telemedicine. Okay, so I believe it's the amount that is practicing telemedicine are minor one. There are not much apps or this thing that are in Nigeria. I think there are a lot of them. I don't want to mention them because I'm not advertising for anyone. There are a lot of them. I think I know 3 or 4 of them that are on internet that uses patient provider interface where you can have telemedicine form of contact. So it's existing in Nigeria, right? But however, the percentage I know is less, which I have said one of the barrier is there is a gap between the digital literate and the healthcare providers. So until those things are able to match, we can now be able to have effective delivery of telemedicine.
all right, sir. Thank you so much, sir. So my
You're
last
welcome.
question is that, how do we know organizations or hospitals that are legally, um, how do I put it now, that are legal to use telemedicine, so that we won't fall victim of any organization claiming they use telemedicine? So um, is there like a number, or like a tag, or I don't know,
No, there is
that we
no
can use to
special
verify?
body. Yeah, in some country there are bodies regulating, even licensing it. So in some country you might be licensed to do that in state A, but you can't do it in state B. For you to consult someone in state B, you have license. But coming to our country now, the people that are working through apps. Some people develop some app where they employ some medical doctors. So the major criteria is they are licensed doctors by the Medical Dental Councils of Nigeria, right? As far as you are licensed, you are they will induct you into the app and you consult through those app, right? But for now in Nigeria, which we are looking for the future, there is nobody now that is granting license for a doctor to practice telemedicine. But such bodies are in existence in some part of the world that have higher digital literacy rate.
All right, sir. Thank you for making the clarification. We sincerely appreciate you. Thanks for your time. Thank you for honoring our invitation. Thank you so much. So far, I believe we all have learned one or two things at the course of this National CDS webinar this morning. So, um, please, let's take our attendance so serious. And right about time, I want to please, let's follow Mind the Gap on LinkedIn, on Twitter, that's X, on Instagram, on Facebook, and on TikTok. Please, let's do that. Can we get the link for our social media handles also in the chat section, so that our DLCs from various states can follow up? Please retry the link. The access has been granted to all of us already. Please, the link is now working. Let's retry it. Let's take our attendance, please. Let's check the link pinned to the comment section. The access has been granted. It has been granted already. Please, let's recheck. Let's recheck, please. For those of us that are successfully filled our attendance, okay, Henry is saying a big thank you to Dr. Obina. We are trying to check this link, please. The access has been granted, though. I don't know why we are still having issues with it. Good. Thank you so much, Tanimola. It has been removed. Please let's fill the attendance list, please. The link. Let's fill up our details. Oh, the link has been removed. It's going to be replaced already. So let's round up the National CDS webinar for the month of September. And I want to leave us with this word of advice, just like as Mr. Dr. Obina said earlier. Telemedicine is not a full replacement for in-person examinations. And at the moment, we are still growing in Nigeria. And one of our goals in Deal for All is that each and every one of us should have one career path. I believe this is the best time for us to start building amazing websites, amazing apps to help with this telemedicine. So we are looking forward to get like a good feedback. Okay, please, the link is now working. The link is now working. Let's fill it up. The link is now working now. Thank you so much, everyone. So it's high time we start. For those of us whereby our PPA is a tech hub, or we have a knowledge in software, website design, and every other things like that. Please, it's time to code out our devices, our websites, our applications for telemedicine. And I believe we are going to reach this goal together. Thank you so much, everyone, for joining the National CDS meeting today. My name is Victoria Alabi, the national president, dear for all national presidents. And with this, I want to wish us all a wonderful day and an amazing bye bye. Thank you.